So so you cross off the $7.95 on that membership fee form. So it's a membership agreement form, and right down there it says $7.95. So you'll just cross through that.
And Janice, it doesn't want to write on the waxy part of the form, so they may just want to jot it down on here.
Oh, okay. So if your pen is brand new, you know.
Oh, this part here doesn't want to write on here.
Oh, up
When you
there?
write on this side.
On the white side?
Or you can write on this side, on these.
Okay.
It's
Well,
just
I,
as I think it is.
okay. I apologize for that if your pen will write.
But if you set up to
So,
But if you do it to the right where the white.
you know what? We'll figure it out if you're doing that. So the introductory offer will be good through this month and next month. If you aren't going to sign up today, please do so in this month or next month, and you'll get that introductory $3.95. If you're signing up today, though, you get it at $3.45. So we want to thank you for doing that. Any other questions of me or the care advocates?
We have friends that want to attend one of these. Is there another one?
So we are going to have another public forum event, which will be on March the 22nd. There is a flyer in your packet. Can you pull it out here? So here's an invitation to the next public forum. We are also going to be setting up programs, and we would love your help, setting up programs at churches and other places where anyone would want to know about this. So I'm going to go on the circuit, so to speak. If you can help with other locations, that little card would be a great place to jot that down. And we can do service clubs or whatever you have. Yes, sir.
The two charges up to 2 hours and after 2 hours, the $5.95.
Thank you. I
Is
forgot.
that plus
No.
after 2 hours?
No.
Is that-
So I call it my drive-by. If you had a splinter and you went to the emergency room, I mean, maybe you had a bad burn or something. Went to the emergency room, the paramedics came in, and you called the advocate, and the advocate came, and after a few minutes, or an hour, or 2 hours, you say, you know, I think I'm fine, you don't need to stay. I'm gonna call that a drive-by, and if we do a drive-by, it's only $5.95 instead of the $9.95, because you're not going to be there for the long run. So it's enough so that I can cover the salary of my client, my care worker who has spent the time going and coming and being there. So that's what that's about. Thank you for asking that question. Yes, hi Dana.
Hi, how many members do you have now?
We have a handful right now. So this is our inaugural launch, and we're ready to take signups. Any other questions? Oh, yes, sir.
How does the notification process work?
Notification.
So an event takes place and the ER is called, or the
Great question.
911's called.
Great question.
Do you folks, how does that work?
So if you're in your home, you will have a sticker for the front of your refrigerator that says emergency contact, and it's the phone number that comes directly to the care advocates. So the EMT know to go to your refrigerator. All EMT know that, and see if there's an emergency. So if you aren't signing up, Dr. Landsberg's little packet that she gave you, that goes on the front of your refrigerator. So you can put your emergency papers in there. But that's a good question. Now, if you're not at home, we've got an emergency wallet card. So it's your emergency contact. In case of emergency, please call my advocate, and the phone number's right on there. So that's for your wallet. There's also another card that's going in your glove compartment of your car. So you'll have that with you too. And we can give you more copies of it. Did it go? Oh, here it is. We can give you more copies of it if you want to put them in other places. We're also going to write a letter that you can give to your family so they know what this is. So,
And our primary doctor and all the other people that need to know.
sure,
Get copies.
absolutely, yes,
You know, that's a-
that you have a care advocate.
So going forward, if this is Santa Clara County at this point in time, is there a second tier of service available out of county? And how does that work?
Thank you. So that's also true. So if you're on vacation in Tahoe and you end up in an emergency, we can't get to the hospital in Tahoe, but we will be on the phone to them, giving the emergency room all of your medical information. So when they call that emergency number, they're going to get the care advocate, and she can email or fax the medical information directly to the hospital where you've been taken, you know, wherever it is in the world. I assume.
So,
They have-
one question, what happens if it's a permanent change of residence out of county? Can we still be members and get a different tier of service?
For now, if it's in a neighboring county, San Mateo, Santa Cruz, Alameda, and it's not very far out of the county, my care advocates have said they will go outside of the county. At least, ladies, don't panic. It was the head ones, Colleen and Jennifer, said they would take care of that. They will get there. Of course, they'll get there as quickly as they can. They may not get there in an hour, given, especially with traffic and the distance, but they'll get there. If you move out of the county, we haven't yet expanded to your new location, then you may stay on the program, but the most we can do is the telephone help if it's further.
And is that at the same fee?
It would probably be a lesser fee. Yeah, we really haven't worked out that because we're trying to get it started right here in this county first and see that we're okay.
Sure.
Yes, Dinah?
Why is this a Delaware corporation?
Because the lawyer said. It has to do with corporation law and stuff. So you got lawyers, I've got lawyers. Yeah. So the lawyers recommended Delaware. Delaware is the easiest state in which to incorporate. And if we are taking this, the expectation is that this is going to be wildly successul. And I'm going to end up in Maryland, maybe franchising it. And if we're not in just one state, it's better to be incorporated in Delaware than in any state. So if we have multi-state services. So it's on the recommendation of the attorneys.
So this service is not Pennsylvania, Delaware?
No. It's only right here in Santa Clara County. Right? Only, anyway, this is the best place in the world to live anyway, right? Other questions? Yes, sir.
A couple of questions. One, is there a husband-wife discount or couples discount?
Thank you. Yes.
And two, when the person goes to the hospital with their interaction with the doctor, what is that interaction? Do they question medicines, or do they know, what kind of advice do they give, or do they just work with you, more specifically on how do I know that their advice to the doctor is correct?
Okay.
Playing devil's advocate.
Okay. Let me answer the first one because that's a good answer for me to give, and I'm going to let Colleen come up here and answer the second part of that. But the first answer is yes, there is a couples discount for the second spouse. So on the enrollment, it's an extra whatever the enrollment fee is. So today it's $345. The second spouse is $200. If you are two spouses on the same plan, the two of you won't pay $89 a month, it'll be $69 a month. So there's a discount on the $20 each. Now that enrollment requires you to both be home at the same time, because they're going to come to your home to do this intake. This intake's going to be really important. It's going to be an opportunity for them to get to know you on a very personal basis, get to assess your home so that they know what kind of living environment you're in, so that if you're in the hospital, they know whether you can realistically go back to that home given whatever your condition is, at least without going for a lot of rehab. If they follow you into rehab, they're going to get to know you as far as what your wishes are about where you want to live. Are you dedicated and just, what's the right word, hell-bent on being in your home? And I mean, not Mike's dad, but somebody was talking, was it you, Jane, that was talking about the husband the father who wanted to be home? I can't, was Mike? So being at home is important to a lot of people. Aging in place now, they call that. And so our dedication is to try to get people recovered as fast as possible and as completely as possible. And that's the whole point of this. So getting to know your environment, getting to know your community of support, and how are you going to be able to how are you going to function once you get back home. We had a client last summer who, she wouldn't join the law firm's elder care services, and she ended up in the hospital with pneumonia. And she must have been there about 2 days, and she must have gone by ambulance. And I say that because later what I found out. So she called us on a Friday morning. She called me, and this lady's voice was clearly, she was in distress. She was so weak, her voice was. And I knew her. We knew her because we were her advocates or her care coordinator for her husband, who was in a nursing home, but she wouldn't hire us. Because of the cost, I'm sure. But she called and she said she has pneumonia, that she was in the hospital and they discharged her, and she's been at home, and she's been on the couch for 4 days. And she can't get anything for herself. She couldn't get out off the couch to go to the bathroom or to get food or water. She had been on the couch for 4 days. She fortunately had her phone, thank God. She called me and I said, please let me send Jennifer. And she said, okay. Jennifer got over there and called the doctor. And she had been discharged after a couple of days in the hospital, probably just for observation. She went home. She had raging pneumonia, and she had contracted C. diff, which is an intestinal bug, while she was at the hospital. 2 days later, she would have been dead. She has a daughter in the community who wasn't even checking on her. She didn't want to be a burden to her daughter. Now this daughter was someone that might not have taken her anyway to the hospital, but this is so important that we follow up the care once you leave the hospital to make sure that you're okay, that you're not laying on that couch getting sicker and sicker and becoming dehydrated. So we've got tons and tons and tons of stories of people, and that's one of the reasons I just think that this program is going to help us take charge of our medical care, because we don't have Dr. Welby's out there anymore. I mean, Dr. Landsberg is about as close as you can get to it. but to have that, to take charge and make sure that we're okay, that we're not a burden to our kids if we have them, is really important. So now I'm going to let Colleen talk about what's going to happen at the hospital. How does she interact with the medical staff?
All right, first of all, I just wanted to make it clear, I will travel to Hawaii. I'll make an exception, I will go. Another mention I wanted to say on the refrigerator situation with the magnet. A lot of people probably think like, okay, what paramedic's gonna know to go to my refrigerator to read a magnet? I got 1,000 of them on there. And actually, paramedics and EMTs are trained to look at the refrigerator, because that's where, if you have your pulsed as like your DNR, if your life, your life support wishes, whether you want to have, medical intervention or, no intervention at all, that's where they're trained to look if you are non-responsive or unable to give the information. So they will see that on there. So if you fell or something. When you do get to the ER, we're not there to question your doctor. We're not there to tell them that they don't, the ER doc, that they don't know what they're doing. We're there to bring the information to them. A lot of emergencies, such as strokes and heart attacks, are very time sensitive. And if you come in, maybe with a neighbor or a friend who doesn't know the information about you, you spend a lot of time laying there. And we try, as nurses and doctors, actually more the nurses, to find your information. We try, okay, do you know who the doctor is? And we call one doctor, and if it's after hours, you're waiting even longer. So that delay in treatment could really make a difference in your outcome of your situation, okay? So, for instance, like strokes. If you're treated within 3 hours of your stroke, your chance of 100% recovery is humongous. And we have a lot of patients that wait a really long time. They're like, I had this kind of numbness and this, weakness on my left side, and I just thought it'd get better. And they wait and they wait. And when they come in, there's not a lot of stuff we can do to, alleviate the brain death of the area of the stroke. Okay, so they have really good intervention drugs now that help to bust those clots up and get you back to normal, which really does make a difference in your outcome. So bringing them that information and making sure they have everything, your allergies, that sulfa one was pretty scary. The doctors try their best to put the pieces together as they get them. The truth is, a lot of times when elderly people come into the ER and we don't know them, we don't know if they're telling us the right information, okay? So I've had patients labeled as, maybe she has dementia because she said something that was, didn't make sense. And we did have a patient one time who came in and, was in her 70s. And she's, we asked her, do you have any medication that you take? And she says, yeah, I do. My mom's going to bring them later. And of course, the doctor's like, this lady doesn't know what she's talking about. So an hour later, a little old lady in her 90s came walking down the hallway saying, hi, I'm the daughter. And the doctors ran back to that chart to erase that dementia on the chart. So, we want to believe everything that we hear as much as we can, but again, the ER staff does not know you. So they're not going to know whether or not what you're telling them is actually sufficient or I've had people bring baggies of meds all mixed together. I take 2 purple pills, 1 orange one, and that's how you get those blood pressure medications, and you have 5 of them because maybe the doctor changed the dose and you kept the bottle. Because, costs money for prescriptions. So you save them, or you borrow them from somebody else, or, we have a lot of people who do that, trade meds and stuff, which is not good. So we are there to help facilitate the communication of your wishes and your health information history to the physicians so that delay in treatment does not happen and that we can get you in and out and better, because you do not want to be in the hospital any longer than you have to, because it is a germy place. Sorry, we try our best, but sick people have to come through there. So with that information is immensely important to an ER nurse. When somebody comes in with a caregiver or somebody who's been in the person's life for a long time and comes in with that med list, we are like, thank you, thank you. You've saved us so much time and extra work. Expenses, if you have co-payments for lab tests and x-rays and CT scans, you know what, they'll do them all because they don't know. So, your bill is just piling up if you don't have the right, coverage to cover everything. And we're there to eliminate unnecessary, not so pleasant interventions sometimes, and really make sure that the doctors know your wishes. They really want, of patients that I really do not want to go to a skilled nursing, or I really would like to stay at home as long as possible. We really try to get what you want, that's medically appropriate. So,
Thank you, Colleen. Any other questions?
No.
Yes, ma'am.
Yes. I'm a Kaiser. I
Uh-huh.
have Kaiser insurance.
Yes.
My life is on file and that.
In their
on the
computer.
Computers, absolutely.
You know,
All the medicines I take, but I live in this place called the HM in
Uh-huh.
San Jose.
uh-huh,
And we have to put this in our refrigerator, have to put the pulse in there, and then we have to put all of our
advance,
medications.
okay,
It's
Uh-huh.
all written down.
it's written
It's
down.
in the refrigerator in a vial.
Right. So in that kind of situation, the care advocate's probably going to, of course, we're going to try to make sure that your information is all up to date, but they're going to be more the advocate. They're going to be talking to the doctor about who you are and what kind of person you are, and that this, I remember a long time ago, I was probably 19, and I was visiting a cousin on the East Coast, and we went in her convertible to the beach, and we sat on the beach all day long, and we were in this car in the sun on the way there and on the way back. Got way too much sun. No sunblock in those days. So I got back and I had some skin poisoning from all that sun, and my lips swole up, looked like Angelina Jolie, right? So not at all what I look like. And so we went to the doctor. I went to the doctor there in Virginia, and he looked at me, he says, so, looking straight at me, he says, so what's wrong? And it's like, can't you see? It's something's wrong. It's the lips. And they don't know you. They don't know that whatever's you're doing, the cognitive way you're acting is not you. They don't know, they may have your medication, but they don't know you, and unless you can point to your lips and say, this isn't right, then you're gotta depend on somebody else to be there talking to them. If you're admitted to the hospital, before you're discharged, we're gonna fight tooth and nail, we're gonna argue with that doctor. We're not doctors, but we're going to argue with that doctor if they are trying to discharge you too soon. We've had situations where Jennifer went over to Kaiser, and she ended up convincing the hospital that they had to keep this gentleman because it wasn't a safe discharge. They ended up keeping him 2 more months. 2 months. So that really wasn't a safe discharge. But they were hell-bent. They were telling the kids that if you don't take Dad home, we're going to call Adult Protective Services on you. Which is how the case came to me, because they said, whoa, am I going to be in trouble? And so they came in and I said, this is a job for my care advocate. And she went over there, and in the end, the gentleman was placed in in a skilled facility that we were able to find. But the hospital wanted to dump him on a facility. There's something called a hospital dump. Hospitals dump on nursing homes, and nursing homes dump on hospitals. Send them over, won't take them back. Sorry, this is too difficult of a case. So the care advocates are going to be available to help get the right placement and keep those people from dumping you. Yes, sir.
Yeah, I observed a situation recently where the hospital was discharging this person as terminal, but didn't tell the spouse, didn't indicate the word terminal. It was written down. She had no clue on how to deal with it, but she accepted the discharge. Now it was up to her to deal with it, and she had no resources. If she had said, no, I can't take him, the state would have been responsible. Now, how does that play into what you have?
So legally, a hospital and a nursing home, or any an assisted living, cannot discharge you unsafely. But if the hospital says, Gina, ready, you can take Dad home now, and Dad says, yes, I want out of here. So you just take him home. because they said he could go, and he should leave, right? They said he has to go home. If you were that family where they were threatening the kids with Adult Protective Services, and they knew they couldn't take care of Dad, then they came to an attorney to help them. The hospital is relieved of their responsibility to make sure it's a safe discharge when you voluntarily take Dad home. Same for a nursing home. So if a nursing home gets the patient from the hospital and they don't think that this is a very good patient for them, they are responsible for finding a safe discharge unless you voluntarily take them. So, you tell the kid, tell the family, okay, it's time, the wife, you should take him home. Now, knowing about the terminal condition, that's one of the places our care advocates are going to know that because they're looking at your chart. So I've had a question in the past, how do they have the right to do that? You waive privacy for us. So we can give the hospital your waiver of privacy, and we're able to be your advocate there. So we can, Colleen in the hospital, she gave them the piece of paper and they said, well, here's the chart.